An aneurysm is a congenital defect of the blood vessels, the arteries to be specific, in the brain. And often, as people grow up and as they get exposed to certain factors like hypertension, which is high blood pressure, and also as we grow, we are blessed to grow, and many other factors, they contribute to enlargement of this defect. They enlarge to a point where they rupture and bleed, leading to stroke. Aneurysms are very common in our environment. And these days, on a weekly and a daily basis, we are seeing a lot of people with this kind of brain aneurysm. Often, if you don't treat them, they are going to rupture and the consequences are disastrous. Symptoms, normally people who have aneurysm may not have symptoms. They may be normal people, but occasionally some may get headaches. They may get issues with their eye orientation. But then when they rupture, the consequences lead to headaches. Often the patient will say that this is the worst headache they've ever had in their life. And of course, they may also get neck stiffness and other symptoms that when they come to hospital, we are able to elicit. Today we are going to do what we call brain aneurysm coiling, which means that someone with a brain aneurysm who is bleeding is going to have some coils placed into that aneurysm that is bleeding to save this person's life. Yeah, you see. So this small incision is what we are going to use to do the whole surgery. Okay, let's go. Yeah. So far we are close to where the aneurysm is, and we're going to try to get as close to it as possible and then finally enter it. Sure, I can stretch it. right? As you saw, what we did was to put in this thing called the sheath, okay, through a very tiny incision. So this is like our workstation. As you saw, all the other tubes, all the other wires, they went through here. And we tried to trace the artery from here all the way into the brain, into the point where the aneurysm is. As you saw on the screen, this was before and this is after. So before, there was some sort of a balloon sitting there like a time bomb, ready to rupture. Nobody knows when that was going to happen. But what we have done now is to deploy platinum coils into that balloon or into that space and seal it off. So now, at least the risk of rebleed or re-rupture is taken care of to a large extent. If you left this without treatment, she already had a very nasty experience of this rupturing. But that was a very small rupture. The bigger rupture was waiting to happen. And if that ever happened, there was no way she was going to survive. I mean, her chances would be very, very low. What we have done now is to seal off that bleeding point and to make sure that there's no more bleeding from that point. This is a stroke, so normally they will need rehabilitation after this treatment. However, in 2 days, this lady is going to go home. This treatment is available in Ghana now, and for people who are suffering from this condition or those who may be at risk, we can be able to manage this situation right here in Ghana, as you just saw that of this young lady.